Next, I wanted to talk a little bit about collagen. Now, collagen is very popular for skin, hair, nails, joints. Now, they can help with that. And I would say if you are going to take it, then take it for a few weeks, maybe even a few months to see if you get any benefits. Nothing's going to happen straight away when you start helping. Generally, risk with collagen is quite low, but just be aware of some allergies. And if you're vegetarian, some collagens aren't vegetarian, but other than that, the risk is generally fairly low. Do be aware, different brands have different quantities of collagen and work in different ways. So you can just do your research, and no brand is particularly better than another. So just see what works for you if you do decide that collagen is what you would like to try. Another common supplement is turmeric, and you may have heard that it helps inflammation, helps joint pain, and it can do this. It can actually help with osteoarthritis and just aches and pains in your joints. But it can give you increased heartburn, and it can interact with your medications. And you can find it in common foods or add it to your foods rather than taking it as a supplement. But do be careful, because some people are taking it in excess, and that can cause similar problems to what we've already talked about, kidneys and livers. So just be careful at high doses. Another supplement, I'm not sure whether you'd call it a supplement, but another thing that people take is apple cider vinegar. And from what I've seen going around on social media, people take 1 spoon of it first thing in the morning. And what they say on social media is that it helps with your gut health, it helps regulate, helps you feel better. And to be honest, I've not tried it personally, so I can't say whether I agree or disagree with it, but it can cause some side effects as well. Again, heartburn, some inflammation in your throat, and it is a vinegar which is strongly acidic, so it can cause damage to your enamel if you do take it regularly. You can get around this by avoiding contact with teeth as much as possible. If you want to try it, just do your research first and check with your GP or pharmacist to make sure it doesn't interact with any of your other medications. Next, I just wanted to talk to you a little bit about lion's mane. Now, it seems to be an increasingly popular supplement, and it's derived from a mushroom. Unfortunately, there's actually not a lot of evidence for it at the moment, but anecdotally and from what I'm seeing from people who are selling it, is it does help with memory, focus, and with the nerves. But each supplement is different. One brand will be different to another, and there probably isn't a lot of quality control as to how much of the actual mushroom, of the actual active ingredient you're getting. So it is worth checking, and it is worth checking that the supplement you are taking is safe. It is also worth noting that there are more people that are having allergies to mushrooms or even some of the bulking agents in there. So just be careful if you do decide to take it. And it's slightly different from mainstream supplements. I'm not recommending or saying yes or no to these kind of supplements, but it is just worth checking that it's right for you before taking it. Another supplement that I'm actually hearing on the rise at the moment is this, NAD. Now, NAD is a substance that the body uses to help with metabolism, and it's coming up in social media at the moment to help with anti-aging. Now, there is no long-term evidence to say anything whether it helps or causes harm really with NAD, because it is up and coming. What I can say is it is expensive, and long-term safety we don't know yet. So if you do decide that NAD is for you with all your research, then just exercise caution, and you may find it helps, you may find it doesn't. Everyone's different. Just see if it works for you. Next, I wanted to talk to you a little bit about magnesium. The supplement is hiding down here, and it's actually used very commonly for muscle cramps, constipation, sleep, and migraines. And I have heard from patients when I've spoken to them that it does help, particularly with cramps and with sleeping. Again, the supplements vary in strength for each one. So it is worth just checking and checking how much is right for you versus how much is in each capsule. I have actually seen that capsules are quite large as well, so it may be difficult to be swallowing them because some of them require you to take 2 or 3 capsules a day, and they shouldn't be crushed or dissolved or anything, so just be aware of that. The biggest side effect with magnesium is diarrhea. So do be careful, particularly if you're taking more than 400 milligrams a day. And if you have kidney disease, they can affect your kidneys, so do be careful. Your body is generally very good at regulating your magnesium, so most people don't actually need to take any magnesium supplements. But if you do wish to take it to help with your sleep or muscle cramps, it may be worth trying for a couple of weeks. But it is worth, again, doing your research beforehand.